So we are on 2:15 UK time, which is the official start time. Yeah, we still don't have our third, the speakers for the third paper. So if they come in a bit late, we might need to just help them kind of arrange and set up. So bear with us on that. But we will go ahead with the presentations that we have. And then if they don't arrive, then we'll go straight from those two presentations into the discussion. So just to welcome everybody. This is the third session in the panel on the politics of expanding and sustaining social protection, continuities and ruptures in unsettled times. And some of the papers in this panel have picked up on COVID-19 specifically and the kind of disruptions around that, and others have looked more at sort of broader political dynamics, not necessarily COVID related, but we are in unsettled times in many ways at the moment. So there's a lot of interesting ways that we can interpret this question in relation to social protection. So I'm one of the co-conveners of the panel. I'm Kate Bruce, based at the Global Development Institute at the University of Manchester. I'm a postdoc research fellow there. And I'm co-convening this panel with Hangala Siachwena, who is on the call, who's based at the University of Cape Town, and Isaac Chinyoka, I think also based in Cape Town at the moment, as well as Nabila Idris, who is unfortunately not able to be with us, but the four of us have brought this panel together. So thanks to the others as well for your work on it. And thanks to everybody joining for this third and final session. So I'll first introduce the speakers and the papers before we begin the presentations. So first we're going to have Joseph Hassan and Afia Adabo. I think Afia is going to be presenting at least first initially. And the title is slightly different from in the program. So the title of their paper is going to be Social Protection Systems in Ghana in an Era of COVID-19. Challenges and adaptations for livelihood security and social policy. And they're from Brandeis University in the US, if I've got that correct. Then we'll be moving to the second presentation, which is Hassan Javid, Samin Ali and Umer Javed from Lahore University of Management Sciences. And Hassan is going to be presenting on behalf of that paper, which is entitled Securitized Digital Governance, Cash Transfers and the Expansion of Social Protection in Pakistan, COVID-19 and the NSAS Emergency Cash Program. I hope I pronounced that correctly. And if they join us, we are also supposed to have colleagues from Obafemi Awolowo University in Nigeria. That's Folorunso Odano Ogun and Busolami Ojo. I was hoping they would be able to help me with the pronunciations or ensure that I didn't get them wrong. But so their paper is entitled Poverty Alleviation Scheme in Nigeria, the Case of National Social Investment Programme, NSIP, of the Muhammadu Buhari administration. So if they join us, then we'll do the sort of formal introductions, and but for now we'll get started with Joseph and Afia, please. So over to you, 20 minutes, give or take a few minutes. So.
Thank you so much, Kate, for this wonderful introduction, and thanks very much for putting this conference together. Panel together, my apologies. We are very pleased to be here. So as explained earlier by Kate, Afia will lead on the presentation in the interest of time, and then when it gets to the discussion session, both of us will participate accordingly. So Afia, please take it away.
I'm sorry, the very thing that I hoped wouldn't happen seems to be happening right now. Just a second. Let's see. Okay.
So what might be the problem, Efia?
I can't seem to get my presenter view going, but just a couple of seconds. I will have it. Yes, I think I have it now. So let's share the screen again. And
Okay.
okay. Okay, wow, hiccups. So thank you for the introduction, Kate. I'll jump quickly in. So the outline of our presentation, we're going to give a brief context on social protection programs in Ghana. We're going to talk about the flagship program that we currently have. We'll go through our research questions and methodology, then we'll have a discussion and recommendations. So basically, Ghana is doing well. And so we have a thriving democracy, and all the socioeconomic indicators have been on an upward trend. And unfortunately, the challenge is that during the same time, the gains have not necessarily been evenly distributed. So inequality has risen in Ghana at the same time as some of these socioeconomic indicators have seen an upward swing. Ghana has had a long history of social protection programs. I think one of the first that I could find was the Program of Action to Mitigate the Social Cost of Adjustment that was put in place during the structural adjustment eras of the late 80s, early 90s to mitigate the effects of structural adjustment. But the program that we're going to be focusing on today is the flagship cash transfer program that is currently being run in the country, and that is called LEAP. So the Livelihood Empowerment Against Poverty program is a cash transfer program in Ghana, and it also includes a health insurance component, which was introduced in 2016. Eligibility is quite typical. It's the elderly without any other form of support, severely disabled without productive capacity, often the vulnerable children, and pregnant and lactating mothers in extremely poor or vulnerable households. The unique characteristic of LEAP, I would say, is that instead of conditionalities, like the programs that it was modeled after in Mexico and Brazil and such, the Ghanaian program has co-responsibilities where beneficiaries have to make some behavioral adjustments, but these are not monitored for compliance. And the objectives of the program are to improve consumption, to increase access to healthcare, and to increase educational outcomes. So just to delve into our study, the research questions that were guiding our study are: what are the impacts of Ghana's LEAP program prior to COVID-19? Generally, we wanted to look at Ghana's social protection kind of programming prior to COVID-19, but we zoom in on LEAP. And the second question, we try to look at what has Ghana's response been since COVID-19 in terms of social protection, and we also take a look at how this response has utilized existing social protection systems. So our methodology was in two main parts. The first part was we used an ethnographic approach. So field work for the study was conducted in the Ghana East Municipal District of the Greater Accra region. And the study participants were recruited from the Adotaiman, Damfa, Kweyman, and Utinibi townships. The second part of the study, the part which tracked the government of Ghana's response to COVID-19, this part, data was collected from the periodic, so the government of Ghana, the presidency, had periodic COVID update addresses. So data was collected from those addresses and from 4 major printed media sources. So Ghana Web, City Newsroom, Major Online, and Graphic Online. And then these responses were coded based on our research questions and then analyzed. That part of the the fieldwork was also followed with key informant interviews. The idea was to try to corroborate the information that we had gathered from the different media sources and such. And our hope was that this triangulation would help to address any inconsistencies that would arise from some kind of partisan government messaging or something wrong with the media sources that we're looking at. So let's delve into our results. So for the first part of our study, which was trying to investigate what the impact of Ghana's social protection programs, mainly LEAP, had been prior to COVID, it was generally positive. So beneficiaries reported positive impacts on consumption, on health, particularly health-seeking behavior. Education was mainly whether kids were now attending school more than they did prior to being part of the program, and all these were positive impacts. Social networks had also been improved. I mean, once the strain of borrowing from neighbors and family was removed, most of the beneficiaries reported that their social networks had actually been improved because they were now in the position to help others sometimes. The main issue that we came across was that the effect had been weakened by inconsistent implementation, in the sense that whilst these transfers were supposed to be once every 2 months, sometimes it would go for a stretch of 6 months without the transfers being received. And so that was like the main challenge that was reported by most of the beneficiaries, that they wanted the funds to be available at the time that it was supposed to. The other challenge, broader challenge, is that the percentage of Ghana's GDP that is allocated to social protection programming in general is very little. And due to that, these programs cover only 16 to 18% of people living below the poverty line in Ghana. The size of the stipend itself in Ghana is also small, so that it's about 14% of the average beneficiary household consumption, which is quite below the 20% rule of thumb, that it should be, at least the stipend should be about 20% of the average beneficiary household consumption. Now, for our investigation into how the government responded to COVID-19, it looks like the government strategy could be broken into 2 broad parts. So there were direct interventions, public health interventions meant to curb the spread of COVID-19. And then there were social protection interventions kind of meant to mitigate the socioeconomic fallout from COVID-19. This list is not meant to be exhaustive, but it kind of shows where the government's priorities were. So the public health interventions, they kind of went through 3 phases. In the initial phase, much of the expenditure was on COVID testing, kind of making sure public spaces were primed to be able to handle whatever was coming our way. As vaccines became available, the strategy kind of shifted towards trying to be able to purchase whatever vaccines were available through COVAX, whatever other pathways that you could find. A big chunk of the public health interventions also went towards incentivizing the frontline workers, health workers, to show up and actually take care of the sick at the time. Like I said, the other prong of the government strategy was their social protection interventions. Some of these were universal, so they had free electricity and free water for a couple of months during the height of COVID, when the government had lockdowns in place. Aside from that, there were programs that were interventions targeted towards particularly vulnerable households, disabled, industries that were particularly hard hit. I will not run through all these, but generally there were some programs that were targeted towards the homeless and things like that. A small amount was used to increase the existing LEAP, to expand the existing LEAP program, but we'll talk about that more in our discussion. Generally, the social protection response seems somewhat uncoordinated at some point, because the government has a ministry designated for social protection programs, but at many points, different agencies and ministries were trying to carry out their own interventions in different ways. So we'll talk a little bit about that. So generally, we would say that there were positive sides to the government's response, public health-wise, particularly towards social protection. Also, there were positive parts. So at the outset, the government seemed to have had a plan in place. Funds were set aside. There were trainings to get everybody ready, even before the first cases of COVID hit, I believe, in the middle of March. The government was decisive in using lockdowns. I mean, for instance, closing the borders for a tiny African country was a big deal. The airports were closed for like a couple of months. And so those were very good moves, since most of the cases that were reported in the country initially were imported. So that kind of helped to slow the spread of the disease. There was a strong attempt to use a combination of universal and targeted measures, like I mentioned. Some measures were targeted towards everybody, the free health, electricity, water, and such, and then more targeted interventions were also used. Most importantly, the government is also trying to make long-term investment in physical and institutional infrastructure so that whenever such a thing is to happen again, they will be better prepared. So I think the president announced that they're going to build more hospitals, and they have a plan in place to institute unemployment insurance, which will be a big deal when it finally comes to fruition. What we thought were critical institutional logistical weaknesses with the response, I guess the biggest part is that, I mean, after years and years of reducing state size and functions, and it led to a situation where, like, the states, on the advice of some, I would say IMF and the rest, but it led to a situation where the states had limited capacity to be able to handle a shock like COVID. I use for an example, the health sector had been underfunded for years, leading to inadequate infrastructure and staff, and were suddenly called upon to kind of spearhead whatever intervention that needed to be put in place. The Center for Medical Research in Ghana similarly had been underfunded for years, and suddenly they were expected to handle such a challenge. So they didn't have the capacity to be able to do that. The other thing is that, and this critique, the second one, actually counts for pre-COVID and post-COVID, that only a small percentage of the poor or vulnerable in Ghana are covered by the existing targeted programs. The cash transfer amounts are too small to make an impact. And so that in itself is a challenge, even prior to COVID. But the challenge is that even post-COVID, when other countries have increased their cash transfer coverage, for instance, Mali scaled up its program by, I believe, 591%, Kenya by 800%. Ghana's expansion of our program is only by 5%. So coverage was inadequate before, and coverage has remained inadequate even now. Logistical challenges also hindered our response, and the use of universal programs, while commendable in one respect, I mean, the sustainability of such interventions is obviously in question, because instead of targeting to make sure that those who need us the most are the ones getting it, we often kind of seem to like resort to universal programs, which are very costly and eventually unsustainable. So our policy recommendations going forward, I think I'm sticking within the time. Yes, our policy recommendations going forward, one, state capacity needs to be strengthened. If the state is going to be relied on to perform a developmental role in crises such as this, then state capacity needs to be strengthened. Generally, the portion of our budget, the resources that are allocated for social protection programming need to be increased so that those programs are truly effective in terms of the coverage and the size of stipends that they're able to provide. Low-income workers in the informal sector kind of sometimes fall through the cracks. There were interventions targeted towards them, but to a large extent, they also need to be prioritized. For instance, the social security scheme that is currently being run in Ghana doesn't seem designed for people in the informal sector, even though they make up a huge percentage of the working force in Ghana. And the last point, like I said, I think there's a place for universal interventions, there's a place for targeted interventions. And so the government needs to like continually experiment with what combination of these approaches would make sense for our context and would lead to, would increase the sustainability of livelihoods in the country. I think I will stop here and then hopefully we can talk more during the discussion. So thank you.
Brilliant. Thank you very much, Afia. You're just coming up to 15 minutes, so that was perfect time for a 15-minute presentation.
Thank
you
you.
do have another sort of 5 minutes or so if Joseph mentioned you might want to come in if there was time, so it's up to you whether you take a few more minutes or whether we move on and then kind of wait for the discussion to do more. What do you want to do?
Right. So, I mean, I think Javid is, pensively standing by. So we'll probably let him get started and then we'll come in with the discussion because there are different substantive, interesting points that we could elaborate on further. But in the interest of time, I think we'll let Javid go ahead and then hopefully when we get to the discussion session, or we can come back and then elaborate on different aspects, if that's okay.
Great, thank you very much. Yes, so over to Hassan for your presentation about the ESAS Emergency Cash Program in Pakistan.
All right, thank you very much, Kate, for organizing this panel and giving me the opportunity to discuss this paper. This paper emerges out of a project that I've been working on with my co-authors that's trying to kind of look at the history of social protection in Pakistan and understand the way in which it's evolved over time, but also the challenges and impediments to it. And just to put things in some context, Pakistan does have systems of social protection. They're just not, to put it very simply, they're just not very good. For instance, we have a system of public health provision, right? You have public hospitals which are free at the point of use, not unlike the NHS. But they only cover about 30% of the population's health needs. For the vast majority of people, the private sector represents a much better, albeit expensive alternative. The level of public health provision isn't that great. The same is true for schooling and other aspects of social protection. We have public systems, but they're characterized by a lack of funding, a lack of resources, a lack of institutional capacity in terms of being able to design and implement programs. And also, as our research continues to show us, a tremendous amount of bureaucratic inertia and a lack of political ownership as governments struggle to come up with plans and as successive governments struggle to kind of build on or continue with schemes initiated by their predecessors, a problem that's obviously been exacerbated in Pakistan by repeated episodes of military rule. So in that context, something very interesting happened last year. Last year in March 2020, the current government headed by the Pakistan Tehreek-e-Insaf launched its ESAS Emergency Cash Program. Now, the ESAS Emergency Cash Program was aimed at providing cash payments to families that were most affected or most likely to be affected by COVID-19. By the end of the year, just to give you a sense of the scale of this project, by the end of the year, approximately close to about $1 billion had been distributed to an estimated 15 million families around Pakistan. That comes to about 90 million people. So this was a very sizable cash transfer program. And it's also important to note that this is going to continue in the next fiscal year as well, with additional funding and the aim of expanding its coverage further. Now, the ESAS Emergency Cash Program was built on top of a prior cash transfer program called the Benazir Income Support Program, which was first initiated in 2008, and which by 2020 was catering to around 4 million families, right? So it was quite significant that, and I guess another point that's worth mentioning here is that the scaling up of the Benazir Income Support Program in the form of the ESAS Emergency Cash Program took place very quickly. Literally within a matter of weeks, the government was in a position where it could provide these payments to all of these new recipients. That's the first interesting thing that happened last year. The second thing that happened is that the government also expanded what it called its Sehat Sahulat program, which is a health insurance scheme whereby the government provides health insurance worth about 1 million rupees, which is about, I think, $6,000, $7,000 for citizens for inpatient medical expenses. So, surgeries and procedures within hospitals. This is a universal scheme, right? The Asas Emergency Cash Program and the Benazir Income Support Program are both targeted. They're targeted at the poorest segments of the population. The health insurance scheme is envisaged as being a universal program that everyone will be entitled to. It hasn't been rolled out across Pakistan. It was initially pioneered in the Khyber Pakhtunkhwa province around 2016 and has now been expanded to the Punjab province as well, where at present it caters to poorer households, but again, the eventual plan is to make it a universal scheme. And at present, it covers about 40 million families in Pakistan, which again is a very sizable number. So a couple of questions emerge. When we were looking at this, my co-authors and I had a couple of questions. The first question was, how do we explain the success of the cash transfer program in particular? And more significantly, perhaps, how do we explain the rapidity with which it was designed and deployed? Again, literally in a matter of weeks. And secondly, why is it that cash transfers and subsidized insurance plans have come to be seen and adopted as good mechanisms for providing social protection in Pakistan in a context where other investments in public health infrastructure and social protection remain limited and other attempts at reform have consistently failed? So the answer for us lies in two related things. The first is the adoption of cash transfers and subsidized health insurance is something that we feel emerges out of the development of a very particular kind of state capacity in Pakistan. In particular, we refer to this as securitized digital governance, which emerged as a result of Pakistan, primarily as a result of Pakistan's involvement in the war on terror in the early 2000s. What this has basically entailed is the construction or investment in an increasingly sophisticated digital apparatus through which to engage in the surveillance of citizens, to track them and collect information about them in various different ways. But what we argue is that one of the kind of what's basically happened is that this capacity, which was developed for security-related reasons, is increasingly being redeployed for use in the provision of different kinds of government services. So it tells us something interesting about how that kind of capacity developed in one context is applied in another. The other thing that's happened, we feel, is that at the same time that Pakistan was investing in the development of this securitized digital governance apparatus, there was a tremendous amount of support from donors, particularly the World Bank, but also the Asian Development Bank and the Department for International Development in the UK, to invest in both cash transfer schemes and insurance schemes. And as I'll be discussing later on in the presentation, perhaps, again, one of the more interesting things about these innovations, if you call them, in social protection in Pakistan is that they haven't really been implemented with any kind of through any kind of democratic process, in the sense that they've largely been top-down technocratic exercises. To this date, there aren't really any laws. There isn't really any parliamentary protection for these programs. They've all been, in a sense, initiated under other programs. So the Department of Health, for instance, manages the health insurance scheme. Existing social protection schemes, such as one of which is called Baitul Mal in Pakistan, which used to provide charitable donations to people around the country, has been subsumed within the Asas Emergency Cash Scheme, and so on and so forth. So there's been very little kind of the democratic process, in a sense, hasn't really been involved in creating and implementing these schemes. And that, I would argue later on, has interesting implications as well for the sustainability and longevity of these programs. So moving right along, how do we, what my co-authors and I do is we chart the emergence of the securitized digital governance paradigm, in a sense, by looking at developments that took place in the early 2000s. One of the most significant developments then was that in the year 2000, Pakistan set up what's called an entity called NADRA, which is the National Database Administration and Records Authority. And NADRA was created primarily in order to upgrade and update the Pakistan's government's ability to manage records pertaining to the identification and registration of its citizens. Now, Pakistan has like India, like Bangladesh as well, has a long history with identity cards and identity documents. In the early 1950s, personal ID cards were issued in order to register citizens after partition in order to establish their citizenship. And this kind of tendency was reinforced, and the centralized institutions were set up to manage this process of identity registration in 1973, after the independence of Bangladesh, when once again the question of who was or was not a citizen assumed central importance within Pakistan. Over time, ID cards have come to assume central significance in Pakistan's civic life. You need them to vote, you need them to open a bank account, you need them to engage in any kind of meaningful civic or political transaction. And to this day, the presence or absence of an ID card, whether you have one or not, determines the types of citizenship rights you enjoy. For instance, Pakistan is home to very large numbers of people who are essentially stateless, ranging from Afghan refugees to Bengalis who were, in a sense, unable to leave Pakistan or chose not to leave Pakistan in the early 1970s after the independence of Bangladesh, whose ineligibility for these ID cards prevents them from voting and accessing various kinds of government services. When NADRA was created in 2000, again, the aim was to streamline the system, make it more efficient. But from the very beginning, state planners and policymakers were cognizant of the way in which a whole new range of possibilities was opened up by so-called e-governance that would allow them to manipulate and use data to achieve various kinds of state objectives. And by 2007, NADRA's attempts at computerizing ID cards had grown to the point where the ID cards now being issued by NADRA contained a large range of biometric information, including fingerprints, retina scans, facial maps, and so on and so forth. Very large amounts of data and very large amounts of personal biometric data are now encoded within this ID card and within the database that's maintained by the government. And by 2012, it was estimated almost 96% of the adult population had possession of these ID cards. One final point about these ID cards, they're also integrated with the government's other databases. So they're linked to the Federal Board of Revenue, they're linked to the National Socioeconomic Registry, which is a survey that was conducted in 2010 and again in 2018 to ascertain levels of poverty. It's integrated with the immigration database and so on and so forth. And now what basically happens is that every time you need to do something, or every time the government wants some data about you, they feed your ID card number in and they get all your information. They get your familial connections, but they also know how much tax have you paid, which properties do you own, have you traveled, and so on and so forth. And this kind of reaches its peak in 2016 when, and again, ostensibly in order to fight terror, the government mandates that everyone who uses or owns a mobile phone has to register it against their national ID card number, right? So now, if you have a mobile phone in Pakistan, or if you use a phone, that number is registered to your national ID card, and that is again linked to all this other information. Now, how did this capacity emerge? Well, between 2000, it basically emerged in experiments that were conducted and that took place in the areas bordering Afghanistan. Starting in 2000, between 2000 and 2002, for instance, the government experimented with the idea of using facial recognition technology to track and maintain a registry of Afghan refugees who were returning to Afghanistan. This was part of a UNHCR-sponsored project. And crucially, it also mandated the government to provide small cash grants worth about $50 to refugees who voluntarily agreed to return to Afghanistan. That was the first kind of instance in Pakistan where this kind of biometric technology was employed and also used not only to track people, but also to provide them with cash. Biometric verification of this kind was also used throughout the early 2000s to try and stem the flow of alleged militants crossing the Afghan-Pakistan border, with a tremendous amount of US support for these measures, as we find from diplomatic cables relating to this particular issue. And finally, this biometric data was also collected and used to monitor the movement of so-called IDPs, internally displaced people who were forced to leave their homes in the areas bordering Afghanistan as a result of military operations conducted there in the early 2000s. What this did in the early 2000s was, again, develop the state's capacity to A, collect this information, and B, use it, because the next step was that, the final step in the emergence of this kind of securitized digital governance paradigm was finally the development of capacity to monitor and intercept communications. This was something that has been explicitly acknowledged by Pakistan's intelligence agencies. And as I mentioned earlier, it's linked to the way in which cell phone connections are now linked to your national identity number. But interestingly enough, I mean, a slight aside, but Pakistan made use, like many other countries, of a track and trace program during COVID-19 in order to identify hotspots where new infections were discovered. And as was explicitly acknowledged by the government last year, the success of that program was in no small part due to the government's ability to make use of the intelligence agency's ability to track communications, to be able to identify who had been in contact with who to isolate, who to quarantine, and so on and so forth. So again, another example of the way in which this capacity, which was ostensibly developed to track militants and so-called terrorists and so on and so forth, was being deployed in a different context for a very different purpose. Now, once this capacity emerged, that's precisely the time, around 2008, that Pakistan really begins to experiment with the use of this kind of technology to provide cash transfers. So as I said, in 2002, the first experiment in this direction was made with Afghan refugees returning to Afghanistan. In 2009, internally displaced people were also given cash grants to help them resettle in the areas that they had been forced to flee. And this was again linked to biometric registration. You showed up with your ID card. If your identity was verified, you were given a cash payment. And in 2011 and 2010, people affected by floods in the Sindh province were also given ATM cards. They could register themselves using their national identity card numbers. Their details would be verified, basically verifying that they lived where they lived and where they said they lived. And the government would then provided them with ATM cards that could be used to withdraw cash. This is also essentially what laid the basis for the Benazir Income Support Program in terms of how it was distributed. Initially, the Benazir Income Support Program relied on door-to-door surveys and in-person cash grants or mailing cash grants to people using the postal system. But by 2010, 2011, increasingly, the government began to make use of its digital infrastructure to quickly identify and verify recipients for cash grants, and also increasingly to pay them using this digital infrastructure. What we've seen over the last decade in particular is the rapid growth of mobile wallets, which basically allow cash to be deposited directly into people's cellular accounts. And the government itself in the past years announced it's launching its own digital payments infrastructure called RAST, to facilitate these kinds of transfers in the future. Now, evidence from around the world shows that this kind of method, cash transfers, particularly delivered in this way, requires less bureaucracy, there's evidence of fewer leakages, there's greater transparency, and so on and so forth. All of that appears to be the case in Pakistan as well, where BISP and ESAS and related programs have been received quite well. Now, the second peg of this argument, I'll be quick because I'm aware I don't have that much time, but the second peg of this argument was simply the idea that amidst the emergence of this digital governance capacity, we also had tremendous donor support for these particular measures. And in 2006, for instance, the World Bank, the DFID, and the Asian Development Bank pushed for a comprehensive new national social protection strategy that sought to streamline and expand existing cash transfer programs in Pakistan. And in 2008, this is what laid the basis for the emergence of the Benazir Income Support Program, which was initiated by the government of the Pakistan People's Party after the dictatorial government of General Musharraf was overthrown. There's also some evidence to suggest that there was a tremendous amount of kind of international support for this as well, with the US pledging to provide large amounts of aid in support for the expansion of this program. And the same is true for the health insurance scheme I mentioned earlier on, which was pushed for by the World Bank in 2013 and which was kind of piloted and in several phases over the past decade. Now, I'm just going to take the last few minutes I have to kind of think through the implications of all of this. While many have welcomed BISP and SAS for various reasons, we argue that it might actually end up being a form of what we refer to as redistributive neoliberalism. On the one hand, while these cash transfers have improved outcomes such as nutrition, healthcare, education, and so on and so forth, and there is ample evidence to suggest that is the case, we think that the very fact that it's been easy for Pakistan to provide these cash transfers, making use of its digital infrastructure, is precisely why they may not be a good idea in terms of providing long-term solutions to problems of structural poverty. For example, alternatives to cash transfers, such as investments in better schooling, better healthcare, better public service provision, for instance, take time to implement, they're costly to initiate and maintain, and require considerable political will to execute. These aren't incompatible with cash transfers, but in Pakistan's case, what we've generally seen is those kinds of measures being sidelined in favor of this idea that cash transfers and subsidized insurance are the panacea, are the solution to the problem of structural poverty. Indeed, the funding for these programs comes out of the existing budgets for those other programs. So the health budget now, a significant portion of that is going to be devoted to providing health insurance. And we feel this is also a problem because what's also doing is deepening dependence on the market. As I said earlier on in the presentation, we have a sizable public sector when it comes to social protection, sizable private sector. And these health insurance schemes and cash transfers essentially create consumers out of citizens who are free to then acquire the services they need from the market rather than from the government. And we feel that this is a tendency that's only likely to be exacerbated in coming years, given the trajectory Pakistan is on at present. And this is particularly the case when we consider how there's been very little, as I said, democratic ownership of these processes. These are top-down programs that have been implemented. There's very little kind of public, in a sense, involvement or participation in the planning or execution of these programs. And while we feel, again, that cash transfer programs themselves can be scaled up significantly to address some of the shortcomings associated with them, while they're not incompatible with other investments in service provision, the absence of that kind of connection, that democratic connection in the design and implementation of these programs raises questions about the extent to which they can serve as a long-term solution to problems of structural poverty. All right, I will end there. I'm mindful of the fact that I've taken more time than I was allocated, but thank you for the opportunity and I look forward to our discussion.
Thank you very much, Hassan. You were only just over the 20 minutes, so don't worry, it wasn't wasn't too long. Yeah, so thanks for that, and thank you as well, Afia and Joseph, for your presentation earlier. There's no sign of the other presenters, unfortunately, so I think we'll need to continue with the discussion and see if they arrive, but it's not looking hopeful, which is a shame. So yeah, thanks for those presentations. I think they really gave us a lot of interesting insights into the into specific programs, Ghana's LEAP and Pakistan's SAS program, but also that raised a lot of questions that are applicable more widely about social protection delivery, and is also with the COVID kind of responses to COVID as well. So there are many points I'm sure that you'll want to pick up on in the questions and discussion, but I just wanted to pick out sort of three themes that emerged for me, either in one of them or across both of the presentations. One of them was about who is prioritized for these interventions. So particularly in the first presentation about Ghana, we heard about sort of who is vulnerable, vulnerable people receiving cash transfers, but then who is considered vulnerable? So we have these different groups. There was a mention about the gap for the informal workers, which is quite common, where they're not considered necessarily to be the poorest and the most vulnerable, but also they miss out on the formal kind of structures and programs. So there might be a gap there. I also was thinking it was interesting that in the UK, for example, one of the immediate kind of responses to COVID was to provide the scheme that basically made sure that that formal workers who were not able to go into work were compensated, or the companies were compensated for that, so that it really provided protection for a large number of people in formal employment who were considered deserving, in the sense that it wasn't their fault that they were not able to go and work. So it's interesting how understandings of deservingness might be different in different contexts, but also in particular situations, that there was no real resistance to that being brought in the UK, even though it's an incredibly expensive initiative. So those kind of questions I think are interesting, and we can look more into that. Another one was about the, well, initially it was brought up as lack of institutional capacity for delivering these programs, both in the long term, but specifically with COVID, how that put a real strain on existing systems. But also that we see that there are innovations there as well, and particularly the digital aspects that Hassan talked about is very interesting, about the kind of opportunities that might provide. But also that's not entirely straightforward. You know, you have possible improvements around transparency and efficiency, improving the delivery of those services, but then we have questions about citizenship and rights. It's by no means unproblematic. So I think that would be an interesting thing to dig into a little bit more. And then finally, I just wanted to come back to the question that was raised in a couple of the sessions earlier in the week, which was about whether these responses to COVID-19, whether we're seeing sort of changes to existing norms or existing expectations around social protection, or whether we're really seeing a continuity of what was there in the first place. So that came up earlier in the week around South Africa and Zambia. We seem to be seeing different paths. So it might be interesting to explore that as well in relation to these cases. So yeah, I'll open the floor for questions. We'll take 2 or 3 at a time, and then hopefully get some discussion going from there. So if you can raise your digital hand, or okay, so we've got Jeremy from CSSR has questions. So if you'd like to go first, Jeremy.
Thanks, Kate. So I really enjoyed both presentations. Thank you very much. You know, I've been asking similar sorts of questions in the context of Southern Africa, and really asking to what extent COVID results in a change in the path, the social protection path that countries were following pre-COVID. And unsurprisingly, across most of Southern Africa, we don't find much change in the path, although countries may have sped up along the path they were already following. I argue that in a co-authored piece in Global Social Policy. But it begs the question as to how, you know, maybe it's too early to say whether the path is changing, and maybe if countries are speeding up, there's a certain point at which speeding up involves a significant or qualitative shift, right? I mean, as Kate was suggesting, maybe if, for example, who is defined as deserving is redefined, then this might have very important medium or long-term consequences, even if it's not immediately obvious at the time. So my question for Joseph and Afia, if I've got that right, is to what extent do you think, you know, that there is really any shift in the sort of the social protection path or trajectory in the Ghanaian case, right? And insofar as we can tell, or do you have any sense that in fact that there may be political pressures building up which might result in some kind of a shift henceforth? For Hassan, you know, I was listening to you, and I was struck by how much the Pakistani case sounded very similar to some other cases, including the South African case, where the most obvious shift is really in the surveillance and coercive capacity of the state, rather than anything else, and it's partly through the use of new technologies, digital technologies, and so on, as you discussed, but also simply in the fact that under COVID conditions, the state is allowed to, and imposing lockdown, is able to police lockdown in very traditional coercive ways that don't involve any new technology at all. It doesn't involve guns and boots. So a Foucauldian analysis of COVID would say, the big shift is not so much what the states do for people, but what the states do to people. And I think you made that very evident, and it's not surprising in possibly the Pakistani case. I wish we had a Nigerian paper, because it'd be very interesting to know whether in a Nigerian case, whether the sort of Boko Haram northern Nigerian story is in any ways analogous to Pakistan, that the Nigerian state used COVID as an opportunity to roll out a more disciplinary response, possibly under the guise of being paternalistic. But my question for Hassan is a bit different. At the end, you threw out this concept of redistributive neoliberalism, and I'd like to push you a bit on that. I mean, how neoliberal is this really? I mean, you seem to be suggesting that if states give poor people cash funded out of taxes on a rickshaw, development aid, or whatever, right? In what we used to think of as decommodifying people by giving them cash and making them less dependent on the market, right? Perhaps even giving them a basic income grant or a minimum income of some sort. That you seem to think this is necessarily neoliberal because it's turning citizens into consumers. That's a very elastic conception of neoliberalism, I think. And certainly it's not consistent with the sort of the arguments about decommodification that have been central to social protection theorizing over the last long time. So I'd like, maybe you could unpack that a little bit more. And also, if you could perhaps say a little bit more about whether you think that, leaving aside the disciplinary part of the state, whether the reforms, the expansion of social protection is, to what extent is it a kind of a path changer, right? Or is it too early to tell? Anyway, I really enjoyed them both. Thank you very much.
Thanks very much, Jeremy. We've got a question from Edward. So if you'd like to unmute Edward.
Yeah, thank you very much for the presentations. I joined a bit late, so probably my question may have been addressed to some extent. But it follows up from what Jeremy said in relation to social protection provision in Ghana. Work that myself and my colleagues are doing that show, or that point to the fact that existing social protection programs like LEAP and others seem to be rural focused. And what COVID has taught us is that there was a bigger urban bias with the pandemic, as well as the fact that urban inequality was largely addressed by existing social protection programs. Now, based on your work, what do you think policy-wise could be done in terms of shifting the focus of existing social protection mechanisms? Do you think there's a need for tailor-made programs for the urban poor? And what role do you think non-state actors like NGOs and faith-based organizations could play in this dimension? Because what we have seen is that throughout the entire response, the state appeared very incapacitated in delivering services and social protection solutions, particularly to the urban poor. Thank you.
Thanks, Edward. We also have a question from Isaac, so we'll take that one and then go to the presenters, because I think you'll have a lot by then to chew on and to discuss. So Isaac.
Okay, thank you to our presenters. I hope you can hear me.
Yeah.
Okay, thank you to our two presenters. So I have a question. The first one is for Afia and Joseph on Ghana. In your study, are you looking at impacts or you are looking at effects? Can you clarify on that one? Because I'm trying to understand what has been happening in terms of health, in terms of education, even before these COVID interventions, and to make an assumption that the changes that you report here are impacts of these programs. Might want us to discuss more on that one. So can you just clarify on that one? And then I have another question with regards to funding in Ghana as well. So you mentioned a very high, very big amount of money, like 35 million being channeled towards the public health interventions. Was this money from taxpayers? Is it taxpayers' money? Is it money from government? Is it money from donors? Or this is who is funding this? And probably we could see what government's interest or what donor interests have in these programs. And then you suggest that there's need to strengthen the state capacity. My question is how is that done in practice? Because yes, we can just say that okay, the government should strengthen this, the government should do this, but in practice, what does that mean in the context of Ghana? I think I will leave this one for Asani at the moment because it has already been asked. So yeah, thank you.
Great, thanks, Isaac. So really great questions there. We have plenty of time, so you can sort of fully, don't feel like you have to sort of rush and pick and choose too much. You can respond to all of those. So we'll go in the order that you presented. So we'll go to Joseph and Afia first, please.
Thank you very much for the excellent questions, Jeremy, Isaac, and Edward, if I got the names correctly. I would like Afia respond to the first part of Jeremy's question to us, and then I'll proceed with comments. And if it's okay, we'll try to respond to all the three questions on our part, and we'll let Javid also take his part, if that's okay with you, Kate. All right, so Afia, would you be able to, are you okay to take on Jeremy's first question or first part to us, and then
sure, I will take a stab at it, and then you can jump in and make sure everything is good. So I think kind of Jeremy was initially talking about to what extent is COVID kind of going to like shifts the trajectory of social protection programming in Ghana. I think it's going to lead to, I guess, a greater call. I think Kate said something about deservedness, who deserves, who should be targeted, who is vulnerable. And I think that what has happened with COVID is that I guess the vulnerability of a lot of people has been exposed, and there's a greater call generally for some kind of assistance. But I am not quite sure if it's truly going to lead to like any change in the extent of, let's say, the scope. I feel like if it would, that would have already happened. But I think generally in terms of, I guess, political pressure, in terms of people demanding and asking for change, definitely this COVID has been a catalyst for that, and is going to lead to like greater agitation for for more programming. Whether or not it actually leads to an expansion or the creation of new programs, I am not quite sure about that. I'll leave that for Professor Hassan to jump in. I think Edward asked a question about LEAP focus on rural areas. This is something that I found during the field work component of our work. The places that I went to in particular were interesting because they are rural areas kind of tagged into larger urban areas. And I remember talking to one of the program facilitators in the district, and I think the problem that we see is that the proxy means tests that are used to determine eligibility into LEAP programs seem more tailored to identify rural poverty than urban poverty is what I would probably go with, because I mean, if you're looking at what kind of roof do you have, is it straw or is it a metal roof? Those kinds of things are easier. Those kinds of indicators usually are able to pick up rural poverty a little more easily than urban poverty. So I guess Hassan's the surveillance strategy used in Pakistan would be useful in the sense in Ghana, in spite of the larger appropriateness, whether it's ethically and morally appropriate. But yes, so yes, the truth is that LEAP seems more focused on rural areas. And I think it's because the targeting that is used, the proxy means tests that are used, are able to pick up poverty in those areas a little more than it is able to pick up poverty in more urban settings. And that's something that hopefully maybe the program can evolve going forward, because I know for a fact that the facilitator and the district that I visited was constantly trying to explain to the LEAP officials in the central office that there are more poor people than are currently being found in his district using the proxy means test. So hopefully that's something that can change in the future. I think Isaac asked, how will state capacity be strengthened? That's a big one. I think that some of the scaling back or some of the contracting of the state have been conditions of different loan packages or assistance that we have received. I don't know if this is going to lead to a shift in that, but I think I'll leave that question for Professor Hassan. How will state capacity be strengthened? I think I've taken a stab at most of the questions. And
if you what about funding? Can you speak to the funding, please?
Oh yes, there's borrowing. I was trying to look for the specific. As you go on, I will try and get the specific the source of that. But yes, the government has gone back to IMF. I believe there's a special fund, and I will get the specific title as you go on. Yeah.
Right. Thank you so much, Ifya, for those excellent responses. So Jeremy, you asked very excellent questions, and of course pertinent ones for that matter. As you may recall, and I'm glad you were referring to neoliberalism and questioning the nature of neoliberalism as highlighted by Hassan in his presentation. So following our neoliberal experience, in Ghana, and as you know, Ghana was considered as the guinea pig of structural adjustment within the context of this Washington Consensus Initiative. So Ghana was required by virtue of the IMF and World Bank stipulations to withdraw or to stop or to curtail all forms of general subsidization of social services. And for that matter, we haven't necessarily had any significant subsidies from government or any structural support system in place that would amount to a form of welfare or a welfare program. So LEAP then emerged as one significant program that has consistently or stayed for a period of time and has been permitted by these institutions as it were. So people were, of course, very significantly affected as a result of structural adjustment, and then with the introduction of PAMSCAT, the program of action to mitigate the social cost of adjustment, that was basically restricted to the social cost of adjustment. And so we weren't necessarily allowed to expand or get back into our previously existing safety net programs that were run by the government. So that had been a significant shift in its own right. So with the introduction of LEAP, of course, many members of the society were concerned of the fact that the sampling and of course identification, as Efia described, is not necessarily adequate because there are many more poor than who are currently being targeted, or those who are being permitted to be part of the program. So there's a call for more, and we in Ghana live in what I would personally describe as the Oliver Twist society, where we are allowed to speak our mind. And so asking the Ghanaian, and it's a very common for someone to say, hey, we need the government to do more, because we always believe, we have confidence in government's ability to perform, but then we always believe that the government is not doing enough, which I think is maybe consistent in other societies as well. So there is call for more action, because poverty in Ghana is not hidden. Unlike certain societies where it is maybe stigmatized system of being referred to poor, in Ghana, people are happy to be referred to as poor because they believe that when one is identified, one could be given assistance in that respect. We have an adage or a proverb that says that if you don't tell the doctor your illness, you wouldn't necessarily be able to properly get your appropriate diagnosis, right? So the culture of letting people know that, hey, I need help, is a very common thing in Ghana, but as to how and whether we're able to meet those demands or needs is always a questionable thing, which has even been exacerbated post-structural adjustment by virtue of the fact that the government was restricted to limit its social services and social support to essential services only. With respect to, so there are calls for definitely for more action. Whether the government can meet the demands is another thing, and I'm not sure personally because of the current state of the physical state of the economy, given the fact that the current government has gone to solicit for support from IMF and seeking for other physical assistance in that respect. So to be able to continue the current COVID regime in terms of social service and infrastructure, I mean, I believe it's a little questionable, although there's evidence for more in terms of the need within the society. With regards to Edward's question regarding the urban poor, I mean, the issue has been that we have traditionally have a significant rural poor. I mean, traditionally it's been significantly a rural poor society. So most government interventions to be seen as important and also relevant is often strategically, in my research, directed towards the rural poor. And then we also have a very large internal migration system where people use migration as a labor-seeking mechanism and also a poverty reduction, personal poverty reduction strategy. So you move to an urban area with the intention of maybe improving your well-being and also welfare by virtue of finding maybe better employment. So if this is my analysis in terms of why the rural community or targeting is very skewed towards rural. I'm perceiving that if government begin to target more of urban poor, then that could, I mean, this is just my personal analysis by virtue of my research on migration, that could possibly trigger further rural-urban migration, because then it will become an incentive for people to leave the rural to come to the urban to seek for maybe so that they can qualify for possible welfare program. This is just an analytical perspective that I'm presenting. I'm not critiquing the need, Edward. I'm not discounting the need, but I'm just thinking possibly why that approach might not be taken more seriously by government, because they it could be considered as the fact that everything is often directed towards the urban areas, and then even when it comes to poverty, urban poor is seen as more of a priority than the rural poor. Although if you look at various forms of our services, etc., we have a significant lagging urban sector. So I feel that from what Efia said in terms of even the indicators of means testing being very skewed towards rural circumstances, like the type of roof you have. In urban areas, I mean, you would not be permitted to use thatched roof, for example, right? But then in the rural areas, that is part of the infrastructure. So if you are asked about the type of roofing you have, which is used as a means of poverty indication, then you could tell that the interest is predominantly looking at those who are at the very bottom, which often people residing in urban areas. But then urban poverty is also on the rise because of an increasing internal migration, particularly of young people moving from rural areas of the country to urban areas of the country to seek for better opportunities for that matter, because there isn't much happening in our rural areas. The current government and current president all promised one district, one factory concept. They're intending to increase rural employment by providing increasing manufacturing within the rural sector as a mechanism to allow and open up rural areas for employment, and also minimize individuals having to travel or to leave their various respective rural communities into urban areas. However, I don't think that program has played out maybe effectively, or structurally. I haven't seen many districts with new factories. So I believe probably it's going on, but maybe I haven't seen them personally. So I'm not sure that if we shift towards a rural, shift towards an urban poverty-oriented social poverty reduction scheme where urban poor is being targeted, people will consider that as a failure of the government to help the rural in terms of its promise to alleviate unemployment by increasing maybe employment opportunities in that respect. So that will bring us back to David's point about government investment in structural poverty reduction vis-a-vis superficial poverty reduction initiative. Lastly, capacity reduction, capacity improvement, sorry. We've always had, again, as a result of structural adjustment, the shrinking of the public sector, and then the hope that the private sector will expand. Sadly, we haven't had that explosion or that massive expansion of the private sector. So the shrinking public sector seems to be the same tool or the same spine carrying the whole society. So we have extensive limitations in terms of human capacity or personnel, even within the public sector itself. We have a very excellent centralized system of administration. But then when we go to these districts, particularly as our system of administration comes from the central government, the regional government, and then the districts, which is the lowest tier of the administrative profile in terms of formal administration, we see that there are several district administrations that do not have, maybe I was in the field once, for example, if I give an illustrated example, well, I wanted to talk to the district economic planning officer. And there was one district economic planning officer for a very large district, right? And if that district economic planning officer, such an effective, active individual, goes to the field in working and meeting communities and following up, when he or she leaves the office, there is nobody to cover for him until he or she or they come back. So that becomes, so if the person is in the field for 1 week, there's a significant absence of that particular administration for 1 week because there isn't that support to employ more people, although we have several qualified individuals who are seeking employment and could fill in those gaps. So we haven't been able to fill in, the public service gaps in terms of employment, and that has caused that weakness. I would recommend that we possibly, to address that as per your question, be able to maybe develop government programs where we can employ individuals, qualified individuals, of course, to fill in various strategic public service positions, even be the mid-management capacity level, so that we can then boost what the government is trying to do by virtue of maybe reinventing its social services or being different forms of social or economic protection or development program. In that case, we can possibly see some level of improvement in terms of how we can translate government policies from the central government level, even maybe to the local level through the district, because that is the mechanism by which programs, including poverty reduction programs, are implemented in terms of budgetary allocation and then also application. So I hope we have not taken too much time, but been able to exhaust to a large extent all the excellent questions that you asked. Thank you very much.
Thank you very much for your comprehensive responses. I think after we've heard from Hassan, we should have time for another round. So I will prioritize people who haven't asked questions yet, but if anybody who has asked a question wants to come back on anything, then we might have a chance to do that. So I think you can think about that as well. Okay, over to you, Hassan.
All right, thank you all. Those are some very interesting questions and comments, and I'll just respond to them I guess thematically, I mean, one thing that's come up is this question of who is prioritized, who is targeted, who is or is not deserving of aid. Interestingly, I mean, in Pakistan, a couple of things I think have happened. As I was mentioning in my presentation, the Benazir Income Support Program and the Asas Emergency Cash Transfer Scheme our recipients are decided on the basis of levels of poverty, basically. So there was this massive exercise called the National Socioeconomic Registry, which was this countrywide survey that was undertaken to try and assess the levels of poverty in Pakistan in a kind of multi-dimensional way. But what's interesting is that over time, particularly with Asas, what the government's been doing is it's been trying to expand eligibility in some ways, right? So whereas, a decade ago, the absolute poorest were eligible for cash transfers, as of 2020, in terms of receiving this emergency cash, the eligibility, the criteria has been broadened a bit to include more families and more people. That's why we see this rise from 4 million households receiving grants to almost 15 million households receiving grants. Now, is this sustainable in the long run? Is this something that's likely to remain in place in the long run? We don't know. At present, the title of the program itself suggests that the government, at least initially, viewed this as a temporary measure. It's the emergency cash program, right? And so they have given it funding for the next fiscal year, but beyond that, we don't know. As I said, there isn't, for instance, a legislative basis for anything that mandates the government to continue the program indefinitely or for the foreseeable future. But on the other hand, we have some evidence from the Benazir Income Support Program that once a program like this is initiated, it's very difficult to roll back, right? The Benazir Income Support Program, as I said, had 4 million households that benefited from it. And interestingly enough, the current government, headed by the PTI, has been quite hostile to it in many ways, right? They were hostile to it when they were in opposition, and they remain hostile to it. One of the reasons why Imran Khan, our prime minister, remains hostile to it is and I mean, I'm not simplifying it, he just doesn't like the name. He doesn't like the fact that it was named after an erstwhile political opponent. But despite the government's opposition to it, what they've generally found is that it doesn't make sense to roll it back. Rolling it back entails costs, electoral costs, political costs. I mean, it's very difficult to tell, 4 million families, we're not going to give you this cash grant any longer that you've been reliant on. And so I expect that with Asas, for instance, once you start providing those kinds of cash transfers, rolling them back entails costs. And I wouldn't be surprised if this kind of expansion remains in place over time, albeit there would be, I think, challenges in terms of sustainability and funding it and expanding it further. But nonetheless, I think it's likely to remain in place. And the same goes for the health insurance scheme. On this question of capacity, look, I think what Pakistan's case illustrates, and I think Jeremy's correct, I think we'd find similar instances elsewhere. I mean, what we have seen over the past 20 years, generally, I think worldwide, is an expansion, the ability of many states to basically regulate, monitor, and control their citizens. And Pakistan, I think, is really at the forefront of that in some respects. I mean, there's often this assumption that technology frees people, it liberates them, it helps them evade the control of the state. But I think it's quite clear from the Pakistani case, for instance, that it's also deepened the state, it's expanded the toolkit the state has for tracking and monitoring people. And we certainly see that coercive aspect of it on display in Pakistan all the time, particularly in its more securitized areas where, in the guise of fighting militancy or terrorism, you see increasing amounts of state intervention and involvement in the regulation of people's lives. But at the same time, as I tried to explain in my presentation, it's created the capacity to implement cash transfer programs relatively quickly and seamlessly. It's very easy to identify people who can receive these transfers, and it's very easy to provide them with the money as well. So it's definitely an innovation, I think, but it's double-edged, I think. On the one hand, it does increase capacity to deliver particular kinds of social welfare, But on the other hand, I think there are serious questions that we need to ask about how this data is used, how it's collected, and the coercive power it places in the hands of states, particularly, again, when you consider the context, where in Pakistan, for instance, there's virtually no oversight over any of this. How the data is collected and how it's used, there's very little parliamentary oversight. There's very little citizen input into any of this. And it's interesting, I mean, Jeremy mentioned lockdowns in Pakistan. I mean, again, it's still not clear. I've been trying to look into this. A number of people have. It's not entirely clear under what powers, for instance, the government was able to impose lockdowns, under what powers the government was able to make use of the intelligence agencies to track and trace people, and so on and so forth. So it's this kind of capacity, I think, creates opportunities, but it can be quite dangerous as well without any kind of accountability or oversight. So I think that's something we need to bear in mind as more and more states kind of shift to this kind of model of service delivery. And finally, there was a point that was, and before I get to this point about neoliberalism, there was an issue, question I think Kate raised about creating new expectations as a result of COVID. And again, in 2010, 2011, there's a colleague of ours, Aisha Siddiqui. She's written on floods and responses to floods in Pakistan. And one of the points she makes about the kind of the flood relief scheme that I mentioned in my presentation is that it created what she calls a model of disaster citizenship, whereby in response to disasters or crises, when states respond to disasters and crises, citizens in a sense, generate expectations from those disasters and crises, right? When you give them a cash grant once in response to a crisis of some kind, they'll expect it again next time it happens. It creates that expectation, particularly, as she argues, when you tie it to notions of citizenship as embodied in documents like identity cards. And I think that's the case. When you hand someone a card and say, look, this is your card, this is your number, this entitles you to something. I think that kind of dynamic is certainly at work here as well. So I do think, coming back to the point I was making earlier about ESAS, I do think that once these kinds of programs are implemented, rolling them back is difficult. Now, coming to the question Jeremy raised about neoliberalism, and I think this is an important question. It's one I'm constantly reflecting on myself as well. And I'll concede at the start that perhaps neoliberalism isn't the right way to frame it. But I do think there is something worth investigating or thinking about here, particularly in the Pakistani context. And I would imagine in similar contexts as well. On the one hand, absolutely, yes, giving people cash is decommodifying, right? It's reducing the reliance on the labor market to be able to afford or acquire social services. But I think there's another aspect of it that needs to be considered, which is the way in which social services themselves are increasingly being commodified, right? And that's certainly the case in Pakistan. And that's the point I was trying to make. Because what cash transfers are doing is, they, in my opinion, at least in Pakistan, what they've been doing is they've been facilitating the commodification of social services in the private sector. I mean, Joseph was just mentioning about Ghana, about the expansion of the private sector there as a result of neoliberalism. We've seen an explosion of the private sector in Pakistan over the past 20 years, particularly in areas of social provision, schooling, education, healthcare, and so on. In fact, according to some estimates, according to the national health accounts in Pakistan, for instance, 3.1% of GDP is spent on health in Pakistan. 60% of that is private expenditure by citizens, of which 80% is on the private sector. What the government's health insurance scheme does, for instance, is it's subsidizing to some extent that private expenditure. What cash transfers are doing is they're allowing people to be able to purchase services from the market. Now that might be fine, and that's often the case even in many kind of relatively mature welfare states. The difference, I think, in Pakistan is you don't have existing capacity from the public sector to provide low-cost, quality healthcare. And my fear, in a sense, is that subsidizing the purchase of social services from the market helps grow the market, but doesn't necessarily, in a sense, provide people with the ability to, in a sense, escape or overcome the constraints imposed by poverty in a context where the market itself is very weakly regulated, as is the case in Pakistan, in a context where, for instance, there's no real check on rising healthcare costs or rising schooling costs, and in a context where the provision of cash transfers allows governments to claim we're providing social protection. I think when you bring those things together, what you might end up with, ideally, in an ideal world, is a situation that's a lot more like the United States and healthcare than it is, for instance, like Denmark or Sweden and healthcare, in the sense that, yes, you have insurance, but healthcare is incredibly expensive. Not everyone can afford it. It can be prohibitively expensive. So yes, neoliberalism might not be the right way to think about it. And it is a bit counterintuitive when you think about how cash transfers, and I agree with the idea that cash transfers are good and do help people overcome some of the constraints imposed by poverty. But I think we have to kind of also understand the way in which it, in a sense, is also deepening the dependence on markets in some contexts. As I said in my presentation, investments in public services aren't incompatible with cash transfers. Ideally, I think you should have both, right? And I do think there is evidence, for instance, from Latin America, where you can see increases in cash transfers over time, helping to overcome some of the limitations they have with respect to how they create this dependence on markets. But that's why I kind of made the point I did about lack of democratic ownership in Pakistan. In the absence of those kinds of popular pressures, at least at present, the current trajectory is one where cash transfers are seen as a substitute for quality public service provision rather than supplemental to quality public sector service provision. And in that context, I think what we're likely to see is an increasing dependence on the market for the provision of social services rather than kind of delinking the provision of those services from the market. Anyway, those were just my thoughts on it, but it's definitely something I think I need to reflect on a bit more. Thank you.
Thank you very much for all of those great responses. We do have a bit more time. We're scheduled to be here till 4 o'clock, so we definitely have time for another round. As I mentioned, well, it would be great if anyone who hasn't asked a question, please let me know, but also if anybody wants to come back on something that they asked and the response to that. So anybody got any follow-up questions? For some reason I don't see any blue hands. I don't know if they're not working in this this setting. So either drop it in the chat or just unmute yourself and just ask directly, please.
So, Kate, I wanted to, if there is a question, I will just keep quiet. But if there isn't any question, then I would like to make a few comments in following on what Hassan just said.
Okay, I think I saw Hangala was.
Sure, then I'll leave that. Yeah.
His camera on, so I'll just give him a chance to ask something. But we'll.
Yes, so thank you very much to all the presenters. So I have a question for each one of them. Let me begin with Ifya and Joseph from Ghana. You actually mentioned at one point that the beneficiaries of the LEAP program should be paid bi-monthly, but of late, the government have been going up to half a year before making a payment. I just wanted to find out what would be the main reason they're not paying on time. And I imagine it would probably be revenue shortfalls or economic conditions. But I imagine the government is funding certain programs, even with whatever challenges they might be having. So what would account for why they are not giving priority to funding LEAP or cash transfers generally, and what are they actually then funding as an alternative? And then for Hassan, I thank you very much for your work on Pakistan. I don't know much about the country, but I thought there are a lot of parallels I could draw with my own knowledge of Southern Africa. You mentioned that Parliament has not really done much to provide any laws to promote social protection. But on the other hand, you mentioned that it might be politically damaging to roll back cash transfer programs. I do wonder then if in the long run, political competition between the ruling party and their competitors might actually create or provide incentive for, for political parties to begin to look at cash transfer and say, hey, maybe I should actually, party A would begin to want to outmaneuver party B by saying, let's actually do more to show that we are committed to this program as the way of, looking like a better party than the competitor. So I just wonder if you think that in the long run, there might actually be some pressure for political leaders, even in parliament, to begin to implement more legislation for cash transfer. Yeah, thank you.
Great, thanks, Hangala. Any other questions from the floor before we go back to the presenters?
Yes, I have one for Hassan.
Yeah. Go ahead, Isaac.
No, I just wanted to check with Hassan. So what has been the role of the civil society in Pakistan in terms of pushing the government or talking the government to expand the public provision instead of leaving it to the market to provide for social protection? Thank you.
Great, thanks. So yeah, I'll go to Joseph first again and then come to Hassan afterwards. So we have about 15 minutes left. So if we can be a bit more brief this time than last time in the answers, but it would be great to hear if Joseph, you want to include your reflections on Hassan's response as you in your answer, then you can also bring that in as long as it's fairly brief.
Of course, yeah. I would let Ifya respond to the question on Hangala's question. So Ifya, I think you should take that first.
Oh, okay. Sure. So I think the question was, what is the reason for the delays? And I'm not sure, because I think you're asking what is the alternative when there's delays. It's not that there's an alternative, because eventually the amounts do come out. I think initially some of the issues were logistical. Initially, it was cash being handed out directly before they moved to e-transfer. So you have a card that you use to access. Honestly, I am not too sure exactly. I'm not sure if there's one reason for the delays, but eventually there is not exactly an alternative necessarily. Eventually the amounts do come, even though the way they are supposed to help kind of changes because of the delays, because instead of smaller amounts which are supposed to lead to consumption smoothing, it ends up being like lump sums at the end of like 3 pay periods or 4, and so it has a different effect, which is something that can be I guess we can study a little more deeply for our work. But yeah, I'm not too sure if there's like one reason that leads to the delay. Sometimes it's logistical, sometimes it's just the government saying, well, the funds are not available and you have to wait. And if I can quickly respond to Isaac's question, I think at some point he was asking how the government is affording all these programs, and I said I was going to check. It's interesting. I had made a note here because the government basically went back to IMF, and it's interesting because Ghana has been trying to get out of the stranglehold of IMF back and forth, got out in 2007, went back in 2009, out again in 2019, and now we are back. So the specific, I think, loan facility that I read about recently, which is being used to fund some of these programs, is the Rapid Credit Facility, which is targeted towards developing countries which are facing budgetary constraints as a result of COVID-19. So that is where the funding for some of these public health interventions and the rest are coming from. So I think I've answered Hangala's question to the best of my ability. So, yeah.
Thank you, Ifya and Kate. Just very brief. I think the response I was going to offer is part of the question that has just been asked. So, I was just going to mention that sadly, I don't think, in my personal opinion, although there is continuous increase, there's an increasing interest in government doing more towards social protection, I don't think the private sector can substitute in terms of the provision, given the fact that although we have a sprawling private sector, the private sector is equally incapable compared to what the existing infrastructure the government has to offer such provisions. So for example, when it comes to healthcare, or maybe when it comes to education, although we have private sector services, we don't have government equivalent, maybe government support across public sector institutions, for example. So it becomes when you have to go to the hospital, you get the national insurance, but when there's a major surgery, for example, the national insurance is not able to cover the additional costs that a private sector operation would offer. So that becomes another gap that falls back on the household. So I agree with Hassan in that regard, that though we have a sprawling private sector, its capacity is not, I mean, it's also not there yet. And we feel like, in my opinion, government can possibly do more if we could maybe redirect some of these investments so that the government institutions can be stronger and better in that respect. Thank you.
Thank you, Joseph. So over to Hassan now.
Right. Thank you all again for your comments, and thank you, Joseph, for your comment as well. I mean, that's exactly my sense about this as well. I mean, and my fear, as I said earlier in my response to Jeremy, was that what cash transfers might inadvertently perhaps end up doing is disincentivizing alternative forms of investment in public sector provision. And I think down the road, then that potentially creates various issues in terms of accessibility and sustainability when it comes to social protection. I think the questions Hangala and Isaac have asked are related, so I'll try to answer them together. Hangala was asking if there's no kind of parliamentary law, no legislation that governs these programs, yet at the same time there is this fear of kind of political costs associated with rolling these programs back. Might competition induce parties to take ownership of these plans and kind of promote them further? I think the answer to that is a qualified yes, and I'll explain that. And I think this is something that might be relatively unique to the Pakistani context. There is absolutely a political cost to rolling back these programs, but the assumption of competition between parties assumes there is space for them to compete in the first place. What we have in Pakistan at present, and are likely to have for the foreseeable future, is a very kind of hybrid form of governance where you have the military essentially backing the current civilian government and working with it at the cost of actual political competition. So on the one hand, I think there was some evidence between 2008 to roughly 2018, when you had a relatively freer, more open system, that parties were starting to compete on precisely these kinds of issues, and were starting to push for and promote different social protection programs in an effort to kind of win voters over. But I think that's kind of tapered off over the last 3 years in particular, as the space for political competition has dwindled. So I think the answer to your question, Hangala, is yes, over time, given democratic competition, you would expect to see that happen. You would expect to see them legislate on these issues and not just impose them. But that requires space for political competition, which isn't necessarily a given within the Pakistani context, given the influence the military plays. Instead, I think what you've seen so far is this kind of paternalistic idea that welfare is something that's necessary to maintain order. Social protection is something that's necessary to contain disruptions. It's something that the government's giving to people. It's not something people are necessarily entitled to as citizens, nor is it something that needs to be expanded beyond the needs of maintaining order and containing disruption. That's my sense of how the government views it at present. And that's why I think it's important to have a more kind of inclusive democratic process to shape the future contours of these programs. And that kind of brings me to Isaac's point about civil society and public provision. Again, and this is why I framed it as kind of redistributive neoliberalism, although again, as I said earlier, I might rethink that a bit. But certainly, I mean, what you have here is not a situation, for instance, where these social protection programs have been initiated as a result of labor militancy or interventions or agreements between industry workers and the government over the best way forward in terms of wages, in terms of social protection and provision, and so on and so forth. These are very top-down, technocratic policy programs implemented without much kind of democratic input. The situation with civil society in Pakistan is that you have weak unions, you have relatively weak social movements, you have relatively weak democratic norms and political parties, and you also have a very clientelistic political system, which is incredibly personalized at the local level, where public service provision is tied to relationships with local patrons, as opposed to, again, being viewed as something that's a democratic right. That could change over time, given political competition, but that's the status quo that exists at present. At the same time, you also have very strong narratives coming from the government about cash transfers and how they solve all kinds of problems. I mean, I think one of the most interesting things about the health insurance scheme, for instance, is it's trumpeted as universal health coverage when it's actually not. If you actually look at what the program does, it covers about a quarter of the costs an average household would incur when confronting the market for healthcare in Pakistan. Yet it's championed as universal healthcare. It's marketed essentially like that by governments, and there's very little kind of pushback against those narratives. So in that sense, I think there's obviously demand for greater public sector service provision in Pakistan. It's not necessarily articulated very well given the constraints within which civil society operates in Pakistan. Anyway, I'll stop there.
Brilliant, thank you very much. Again, great answers, and we're doing really well for time. So just as we come to the end of the session, there was a couple of points I wanted to raise, but they're quite big ones, so I'm not expecting you to necessarily reply in the 4 minutes we have left. But perhaps I'll raise the points, and then if both Hassan and Joseph and Afia can just do a final kind of closing reflection, which can either respond to what I say or just be a reflection on the broader discussions. Either way is fine. So I wanted to pick up on the partly the kind of citizenship and expectations aspect, which came out maybe more clearly in the Pakistan case and around the kind of ID cards and that aspect of very sort of formalized citizenship in that way, but one that many people are left out of, as you mentioned. But then also the kind of this universal versus targeting question, which also kind of links into issues around sort of citizenship in terms of rights. Is it that everybody deserves some level of support, or are things quite narrowly targeted? So these sort of very big questions of citizenship and rights, which seems like there might be some scope for expectations to have increased a bit around with the COVID responses, but on the other hand, we also heard that we didn't necessarily expect this to very quickly make changes to how these social protection systems were run necessarily. So I suppose my question is, or my sort of point is, in the Ghana case, you talked about the universal programs being quite unsustainable, unlikely to kind of take off because they're unsustainable. And again, financially, they are very big programs, and there can be concerns around that. But I suppose I would sort of question the assumption that they're unsustainable and kind of ask, well, who is supportive, who is resistant of this sort of universal versus targeted approach? Because we have had, again, in the early days of COVID, it sort of raised debates around basic income and whether that is, when you have a situation where really everybody's being affected in some way, whether that is actually a better way of approaching social protection rather than having these much more fragmented and narrowly targeted programs. So as I say, not a question to kind of necessarily expect an answer to in 2 minutes, but any reflections you have on that or anything else that's come up in the session, that would be great. So I'll give the last chance to the floor for Joseph and Afia first, and then over to Hassan.
Yeah, in my opinion, if you can chip in terms of, I'll be 30 seconds. I think universal basic income will be an excellent possibility if it's practical in terms of the physical infrastructure of government being able to offer that. I'm not sure, given the fact that Ghana, for example, is relying on the rapid credit facility from IMF. I'm not sure the IMF and World Bank will support a universal basic income system in a developing middle income economy for that reason. So that will be my only, question to your question. But otherwise, that would be a brilliant option. And then also citizen participation, I think, is fantastic. I missed part of the panel session, so I don't know whether there's any example of a social protection program which is very democratic. If there are, I mean, that would be a good example to model other ones or improve other ones, because citizen participation in such programs, I think, in terms of feedback and then maybe push, can maybe strengthen and increase the sustainability. That is the part where sustainability in our concern was whether the financial flows will continue, and then also how the government can be held accountable to continue.
Thank you. Do you want to add anything, Afia?
Yeah, I would just say, well, so going forward, it will be interesting to kind of observe. So I guess COVID has exposed the need for like a stronger role of the state, whether it's through implementation of programs like cash transfers, or it's just providing the actual services, the supply of the services that citizens need. Of course, juxtapose that with the fact that now Ghana, for instance, has had to go back to IMF, and then, of course, which means now we are subject to like whatever conditionalities come with whatever assistance that we're going to receive. So it will be interesting going forward to observe like what hybrid form of social protection programming emerges from this. Yeah, thank you for the opportunity to present. Yeah.
Thank you. And Hassan, last word to you.
Thank you. Just a couple of comments. I think again, particularly as I was saying, and as you picked up on as well, especially when citizenship seems to be kind of concretized and embodied in these documents, I think there's a very tangible link, a very tangible expectation that arises out of that. And I think that is certainly something that in the Pakistani case, at least, and I know this is true for India as well, it's certainly something that kind of raises citizen expectations over time. On the other hand, as I've been trying to argue in this paper, I mean, it's double-edged. I mean, we often talk about increasing state capacity as something that's good and desirable, and it is. But we also have to think about what that capacity is and how it's being deployed. And I think in Pakistan's case, at least, the same capacity that allows for cash transfers to be given to people and allows for recipients to be identified and gives that sense of entitlement to them is also a source of marginalizing certain communities, excluding some people from citizenship rights, and subjecting communities to the coercive power of the state. And I think ultimately, it boils down to politics, and it boils down to the kind of pressures that hold states accountable and the ways in which citizens can take ownership of these projects and hold those who govern them accountable. And I think that also kind of touches on this question of sustainability. Are these cash transfer schemes or similar schemes sustainable? I think they are. It's, again, a question of politics and priorities. And I think a state like Pakistan, for instance, which spends so much on the military, for instance, given a different set of priorities, might be able to sustain more expansive and universal social protection systems. So I think ultimately that's the key to all of this. You can have all the capacity you want, you can have the best design systems in the world. How they're implemented, how they're expanded, and how they're sustained, I think, is a political question that's decided there rather than just in the abstract by states and planners.
Great. So come back to It's All About Politics, which is the title of the panel. So very appropriate. And I think we would probably all agree on that. And it's been great to have the opportunity to discuss the politics of social protection through so many different programs and raising these bigger issues, these wider questions as well. So thank you for our presenters today, Joseph Hassan, Afia Adabo, and Hassan Javid. We really appreciate your contributions. Thanks to my co-conveners, Hangala Siachwena and Isaac Chinyoka and Nabila Idris. And yeah, thanks for the questions, and to everybody who's attended today's session and the ones earlier in the week. So let's keep in touch and keep the conversations going. Hopefully we'll come into contact again soon. Thanks very much, everybody.